Hey, good morning, good evening, good afternoon, everybody. Welcome to Age Wise Boston, sponsored by Central Boston Elder Services. As always, I'm your host, Mike Kincaid. You know, we keep bringing in these hidden jewels. Well, this is, I got to tell you, and Steve and I were talking about this. Personally, I think this is one of the best kept secrets in the city of Boston, but it's one of the things that if you're eligible for it, you should know about this. So as always, grab yourself something to write with. You know what I always say, pencil, pen, crayon, I don't care. Because we're going to throw some phone numbers at you, we're going to throw some names, and more importantly, you're going to get some information, and you probably want to take note of this. Stephen, welcome to the show.
Thank you.
You're the regional director of the SHINE program.
Yes.
In regional, we're talking about Suffolk County.
Suffolk County, all the neighborhoods of Boston.
All right, let's just jump right in it. Yep. What is the SHINE program?
SHINE's an acronym that clearly stands for Serving Health Informational Needs of Everyone.
Okay.
Prior to the Affordable Care Act, it stood for Serving Health Insurance Needs of just the elderly.
Oh.
The Affordable Care Act brought a huge expansion in under 65 disabled, low-income Medicaid assisted programs. So now our coverage is much broader than it used to be.
So you just hit it on the head. It's much broader. So it's not just elders and disabled. It's basically someone who's on a low fixed income?
Well, disabled under 65. So they've expanded the disability under the age of 65. A lot more people in this state, it's called MassHealth.
Right.
Okay. Right. It's also known as Medicaid. It's federally funded as well as state funded, but then the state has the authority of what to do with the money. All
right. We got a lot to unpack here.
Sure.
So let's start right off the beginning. If I want to find out, and I'm gonna literally start it literally at the beginning. If I want to get more information, because we're not going to cover all this in 25 minutes, right off the top, how should somebody call, email, whatever, to get more information about this?
So as you know, and we discussed before, SHINE is a program that's housed in Ethos in Jamaica Plain. Okay, our website is ethocare.org. The direct number to the SHINE program is 617-522-9270. It's an automated system. Because of the level of activity in the SHINE program, we don't field live calls. Oh. So it goes into an automated system with clear instructions.
That's a voicemail.
Yeah. The most important thing is that the person leaves their name, their telephone number, and just a small detail of why they're calling. I need help picking out a new drug plan. There's some issues with my Part B through Medicare. They're saying I owe money. So anything health insurance related, we get involved and try to resolve for the consumer.
A lot of times I hear, I don't like my doctor, or I don't like my health. So you're saying I need help picking on a health plan. I hear, I don't like my health plan.
Yeah.
Is this something that they would be?
Absolutely. One of the best kept secrets or misunderstood points of information when it comes to all Medicare plans is Medicare's a 1-year contract. It's year to year. Okay, so right now we're about to approach open enrollment, where people can make changes in their coverage. So you can make changes from October 15th to December 7th for 2018. Whatever plan you're on currently will run out through the end of the year.
All right, stop right there, because this is the other thing that I'm lazy. That's why I can't sign up for those. We'll give you 5 of these free, and if you don't cancel it, you're going to start charging you, because I always forget to cancel it.
Yeah.
And so the flip side of that is, if you don't do anything,
you get auto-enrolled
and
stays
you remain
the same. Yes.
So if you don't do anything.
Yeah. Changes have to be instigated by the consumer.
Okay.
Okay.
All right.
Or they just roll over and in the plan the following year, they'll get their notice of change, what coverages are changing in the plan, or their co-payments going up, or their co-insurance is going up.
Do they get that information far enough in advance to be able to say, my prescription copay is going to go up $5, let me see if I can shop around and find a cheaper one?
Again, one of the biggest barriers to spreading greater understanding and what I call benefit intelligence is you have to open your mail. And consumers are inundated by marketing materials to a degree that I think they just become overwhelmed. And it's hard to disseminate between this is important or this is something trying to get me to buy something. So you will receive, it's called an ANOC, Annual Notice of Change. All health insurance companies have to send them out. They start sending them out October 1st, in time for a person to make a change within the October 15th to December 7th deadline. The question is, will the person read it
In time.
in time and make the change.
You keep saying in time. I cannot tell you how many times I have talked with seniors that opened it on the last week. And oh my God, I've got 5 days to get this done. I don't think I can do it. So let's go way back to the automate. Let's start at the beginning. I've made the phone call. I mean, I'm not happy with my health care plan. And I opened up my letter. What happens? And then I've made the automated phone call with a detailed description of brief but detailed description of what I want. What happens next?
When they call, they'll leave a message, as I described.
Right.
Within 1 to 2 days, they'll receive a call back. Okay? We fill out what's called client contact forms. Okay. And it's basically, we're overseen by the state Executive Office of Elder Affairs. There's a national sort of responsibility to report this information. So we'll take that information down, take the message, I want to change my plan, I'm not happy with it, I'm having trouble, whatever their details are. And a volunteer counselor, a professional volunteer counselor that's certified, tested, and monitored through Ethos, through the SHINE program, will call them back. And we'll start piecing together what it is that they need to do. What I always tell people, if they're not happy with their plan, the simplest place to start is if you like your doctor, ask your doctor what other plans they take as well.
That's a good idea.
It's commonly overlooked. Everybody starts thinking, I have to change my plan, I'll lose my doctor. But again, as we said, you don't know what you don't know.
Right.
They go to their doctor under one health provider, not knowing the doctor takes 4 or 5 others.
It's funny you say that. I was just having this conversation last week with a group of seniors, and I was saying to them, most doctors take most plans.
Yes.
And they're like, no, Mike, my doctor only accepts this. And I never bothered to ask, did you ask them about other plans?
Yes.
Can a doctor make a recommendation about what they consider is the best plan for a patient?
Again, that's a little bit of a gray area that I can't speak to in detail.
Okay.
The doctors will always know from their end which plan is easier to get along with.
For the doctor or the patient?
For the doctor.
Okay.
Okay, right. So it's more of an internal mechanism for them.
Right.
But, it's mandated that pretty much fee-for-service or how they're getting paid is similar across all different companies. It really comes down to,
Really?
Yes, often it comes down to what company does the doctor possibly prefer. There are providers or health insurance companies in the market that have completely closed networks, and that's when you hear my doctor only takes this. Okay.
Oh, okay. So if you've got one of those plans,
Yeah.
I hate to say this because it's going to sound so cliche. If you've got one of those plans and you stay with that plan, you're stuck with that plan.
Everybody's afraid of the unknown. Change becomes a very difficult decision for this age bracket in retirement. So again, the fear of the unknown. And a lot of times the decision to keep a doctor statistically is more personal for a woman than it is a man. Yes.
I find that interesting.
But now, as we discussed, people are outliving their money.
Yep.
And what SHINE offers is, let's come in and look at where you are. What is your income? What is your expenses? Do you need to be paying for a supplement insurance when you could possibly be in a Medicare Advantage plan at a very low to no premium? Okay, so this is a crisis that, is facing the baby boomers that are aging in. Over 10,000 people a day started aging in back in 2012. Now, a lot are continuing to work longer. Many are in group retiree plans, but there's also a trend now taking place for people. We're becoming more self-service, okay? And you have to sort of be plugged into the current changes that are going on. We know there's a hostile political environment when it comes to health insurance and the discussion of it.
That is true.
But corporations are no longer upholding pensions and lifetime health insurance. So these people, I deal with people all the time that have been retired for 20 years on autopilot, and now they get a letter in the mail saying they no longer have that coverage. So then we have to take them in at that point in time and really sort of reverse their thinking and introduce them to something that's often quite unsettling because it's a change. And do I have to change my doctor? Do I have to change my pharmacy? So we're there for all steps of issues like this that come up, and they're coming up more commonly.
All right. We man, we really jumped ahead. So we got to walk back.
Yep.
All right. So first of all, what's the phone number if someone would call?
They would call 617-522-9270.
All right.
That directly connects them to the automated service. I come in first thing in the morning. Other staff volunteers come in first thing in the morning. We listen to the messages. We put them on a daily call log. And then once all the lines are cleared, then we reverse it and we start making outbound calls to contact these people.
All right, so you've reached out now to Mrs. Smith. The counselor has reached out to Mrs. Smith. What's the next step, and what does Mrs. Smith have to do?
Well, a lot of times we can manage the issue virtually, like over the phone.
Oh.
We're also available if people want to come in. So sometimes people are very particular about that. We have locations of counselors across the city. For example, like Dana-Farber, Fenway Health, the Elderly Commission at City Hall. Mm-hmm. These are people that are SHINE volunteers as part of their paid position. So
that's right.
City Hall, centrally located.
Right.
For people, it's close to the T. A lot of times they go there, and they'd see the Elderly Commission there. But the challenge or the details that we sort of have to sift through is the caller completely accurate with their need?
I was literally wondering, do they have all right, so let's pause right there, because this is the question that's dangling out there. And if I'm at home watching this on TV, I'd be yelling, ask the question. Before I make the phone call, what should I have sitting in front of me on my table?
The most important thing is that they have their Medicare claim number. Okay, so as of right now, although changes are coming, a person's Medicare claim number is his Social Security number followed by a letter. So they have their red, white, and blue Medicare card.
I got that. It's, you know what, this is what I find funny. We have worked so hard to tell seniors not to give their Social Security number out over the phone.
Yes, and that is a comfort thing that we'll address on the phone.
Okay.
A lot of times it comes more into play if a person's receiving assistance, like Medicaid or low-income subsidy. We're able to log into the MassHealth virtual database and sort of get the clear story. So when we call them back, well, we have calls all the time that people will say, I lost my insurance. Yeah, they took away my Part B. I went to my doctor. The doctor said I no longer have Medicare. I don't know what happened. I didn't see anything in the mail.
Or I went to go get my prescription, and instead of paying $5, they wanted me to pay $50.
Yes. So sometimes we're able to do research via the phone. We can do three-way calls via the phone. We call health insurance companies all the time for the consumers. We call Part D drug providers all the time for the people. So again, a lot can be done virtually. But the first thing that the counselor does in that situation is sort of disseminate the fact from fiction. Okay, what is it that this person really needs? You know, what happened back here that down here they can't get their prescriptions filled?
Right.
Okay, so that's what they go to work on. Not every situation is resolved in the first 10 minutes. I always say it's a 2 to 3 touch process. So once the counselor calls the contact, a counselor calls Mrs. Smith, listens to the story, asks a few questions, they're able to hang up, look at the programs, see if there's anything addition that we can do, see if the story she told us even sounds right. Mm-hmm. Okay?
Which it's not.
And a lot of times it gets really far off. You know, I had an experience recently where a gentleman worked for a hospital system in Boston. The hospital system, you know, after 20 years of retirement, changed how their benefits were going to be provided. He came in to talk about changing to this new brokerage company that's out of state that's going to be sort of being the administrator now. And after several conversations with him, and I'm looking at his age, and I said, by any chance, were you a veteran? And he said, yes, I was. I was boots on the ground in Korea. This person did not know about the VSO, or the Veteran Service Organization, and all the benefits available to him because he returned from the war, got a job,
there you go,
got married, had a family, and was on autopilot for all these years. So now, due to his income and everything that was going on with him personally, we start by trying to help him get better benefits now that the change is occurring with his former employer, and we find out that this person can get unlimited benefits through the VSO. So what started here as a need finished over here in a much better capacity. And that's very common. Like, we help people save a lot of money when they look at, what do I have versus what do I need? There's a lot of opportunity to spend money. For example, if you have a medical supplement plan and you don't travel or you're relatively healthy, do you need that burden of a couple $100 a month, every single month, every year?
Wait, Stephen, I'm not to cut you off, but hold on, whoa. Whoever's convinced me, notice I didn't say sold me,
Yeah.
whoever convinced me to get that plan, and I'm walking out on a deep limb here,
Yeah.
okay? Notice I didn't use the word assumption. I'm walking out on a deep limb. Whoever sat down with me in my living room or at my kitchen table and sold me this plan, convinced me to go with this plan, wouldn't they know that?
Well, it's not a perfect system. So in all the years that I've been involved in this, and I was on the corporate side at a very large health insurance company for a decade, they're limited in what they can teach you. Okay, health insurance companies are monitored by CMS. It's the Center for Medicare and Medicaid Services.
Okay.
It's the federal branch that sort of oversees all of Medicare. They don't really let the health insurance companies get too far into the language of the basics. This is this is that. So a lot of times people aren't really crystal clear.
It sounds like it.
And the salesperson, it's not really up to them. You know, it's a federal entity. They don't have a marketing budget. They're not out there with television commercials telling you what to do. So, you know, the SHINE programs or SHIP programs that are located nationally, they direct people to these resources. So really, that's where we come in and try to connect all these missing spaces and connect the dots for them when nothing makes sense.
You're being kind. You clean up the mess.
Well,
it is what it is.
It's misinformation because
Right, that's
what
the
I
point.
always say, the thing that upsets me the most about typical consumers in health insurance is you never had choice. Okay, so when you worked at a company 30 years, my grandfather was a milkman for Hood Milk for 48 years. You went down the hall and you talked to Betty. Betty gave you two options. She said, Mike, do you want low payments and high copays and deductibles, or do you want high payments and low deductibles? Which one?
And of course, you always went, okay, I'll take the low deductible because I figure I'm not going to get sick.
Right. And that's the extent of someone's education when it comes to health insurance.
You are so right.
And now, I always say, welcome to retirement. Now, when you take Medicare, now, for the first time in your life, you have choices of whatever plans are being offered in that specific county you live in.
Okay.
So you go from dealing with Betty with one or two options to living in Suffolk County where there's 20 different plans.
The big book of options.
And they're all chasing you with a different angle or a different tease.
Yep.
You know, like they talk about benefits or copays, or they talk about network or, extra benefits.
Free health club.
Exactly. So it's all a different hook, but the person still doesn't have that foundational understanding of the different medical coverages that exist in Medicare.
Okay. All right. So I'm trying to get us, because I'm picturing folks watching this or listening to us on WBCA 102.FM and thinking, all right, so I've made the phone call, the counselors called me back, I've got my card in front of me.
Yeah.
I gave them the number, they've pulled up my file.
Yeah.
Are they going to make a recommendation right then and there, or?
What we do at that point is sort of, fact find. All right, what's the reason you called today? Are you happy with your coverage? Are you unhappy with your coverage? Is it a financial strain? Have you run your income? Do you see if you qualify for programs?
Yep. Okay, so, all right, so we've now realized what programs I qualify for. Mm-hmm. Is that going to be, one of my favorite lines from the movie Philadelphia is explaining to me like I'm a 5-year-old, which is not insulting for me. But I guess what I'm thinking is am I going to understand what this is all about when we get done talking? Or am I back to Betty, but now instead of 2 plans, it's 20 plans?
Our goal and my goal in the office that we share is to empower the person to make the decision. Yes, we have an entire spreadsheet. These are all the supplement plans. These are all the drug plans. These are all the Medicare Advantage plans. And a lot of them, again, it comes down to cost. What can you afford? You know, in researching the person, when a person retired at 65 or 68 years old and entered Medicare, and now they're 80, you can imagine they've seen a different shift in their financial position. So a lot of times it's good to look at the person's total income. You don't have to give me a Social Security number, but I will say, what's your total income for the month? Okay, because that's always one of the important questions we ask, because right from their answer, we know if we can start pursuing assistance programs for them and get them a little help.
All right, one more time, because I asked you this already. If folks want to know how to get more information, or if they want to get in the queue, what's the number they call?
617-522-9270.
And they give a brief detail of what they're looking for.
What they're looking for. I need help with my Part D. I need to choose a new plan for 2018. I didn't know you could run and see if I was income eligible for state assistance programs.
What if they don't know what it is? They just know I have a problem with my health care.
Then we'll fact find. Well, tell me what the problem is. Are you unhappy with the doctor? And a lot of times we've had people that join plans where Beth Israel is their hospital that they need to go with, but they live down in Lower Mills.
Okay.
So that could be something that we work through.
Well, all right, so let's use that scenario.
Yeah.
Would somebody say, okay, for what you're telling me you need and what you're looking for, instead of going all the way to Beth Israel, why don't you just go down the street to Kearny?
We could find out exactly what plans are taken at Kearny.
Okay.
So that would be the answer to that. I understand you go to Beth Israel, it's too much of a challenge, it's 3 buses for you. And a lot of times that a person will sort of they won't get care that they need.
No, I know.
If they can't get there.
But hospital loyalty never ceases to amaze me.
Yeah.
It's like, that's where I gave birth to my daughter 32 years ago.
Yeah.
And I always go there. It's like, but you live 2 blocks from a hospital.
Right.
But, all right. So they've talked with the counselor. Recommendations have been given. Is there any kind of follow-up?
There's always follow-up. I mean, what we do, a person's never closed out. We have an entire data sheet.
Okay.
So if we get to the point where we've told them all the programs they may or may not qualify for, we then have the paperwork to help them enter those programs. Okay, so if they're eligible for assistance, we have all the phone numbers. We can do a 3-way call and literally help them join the plan if they feel more comfortable with that, and they don't have a son or a daughter available to sort of speak on their behalf.
So eventually somebody's going to walk. There's going to be a face-to-face.
Yes.
Translation. What if English is not their first language?
We have many different language speakers throughout our volunteer system.
Okay. Right.
So if they do call up and request another language, we'll make sure that they get connected to a person that will give them the service that they're looking for in the language they understand.
What about reading literacy?
Same thing. It can all be verbal and audible.
Okay. All right.
So if they can't read, then we can just go through the whole thing in a conversation like you and I are having now.
Remind folks again, what's the enrollment deadline?
The enrollment, the change timeline is starting October 15th and runs through December 7th. So a person, if they're not happy with their coverage, if they want to possibly explore other coverage, if they want to see if they are eligible for any state assistance programs, October 15th through December 7th.
Stephen, if there's one thing you want folks to remember about this conversation, if they don't remember anything else we've talked about, what's that one thing?
The most important thing that every Medicare plan is a 1-year contract. So they're not tied into anything, okay? There are other options out there. There are people to help you navigate those options, and that's SHINE. So we're there for the people in the community. No question is a silly question, okay? We want to, again, increase their benefit intelligence and put them in a program that can best serve them as their health needs change, as their finances change, and that's what we aim to do.
All right. Thanks for coming on the show. You're going to be a yearly guest. We're doing this again in October, if not sooner.
Thank you so much for having me. And I'd be glad to come back after the first of the year because that's a different enrollment period.
Hello.
And there's also options available for people then. So there's always time to talk about SHINE.
Consider yourself booked for January then.
All right.
You might be a regular.
Thank you.
All right. There's not much more I can say about this. I told you this was a well-kept secret, but our goal is to stop making it be a well-kept secret. Find out about it. Call SHINE. Get the information. You know, you keep hearing people on the news talking about if you like your doctor, yada, 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 yada. But the point though is that if you don't like your plan, and God knows I've met a lot of you folks out there who complain to me about your health care plan. If you don't like it, you have options. Seek those options out. Call these guys at SHINE and have them, let them help you. Because if you don't let them help you, you're not going to get help. My name is Mike Kincaid. This has been Age Wise Boston. Thanks for hanging out with me. I'll see you guys around the neighborhood. Take care. Bye-bye.